Gavi, the Vaccine Alliance, helps vaccinate more than half the world's children against deadly and debilitating infectious diseases, is part of the key participants at the 75th WHO's Africa session currently underway in Lusaka. Gavi also works with donors, including sovereign governments, private sector foundations and corporate partners, NGOs, advocacy groups, professional and community associations, faith-based organizations and academia, vaccine manufacturers, including those in emerging markets, research and technical health institutes, and the implementing country governments. And now, Gavi is now pushing a local manufacturing agenda for Africa besides research and development.
We have taken concrete steps to respond to your earnest desire to be sovereign in terms of vaccine manufacturing. Africa was at the back of the line during COVID-19. That must not happen again. Learning from that, we put in place what is called the African Vaccine Manufacturing Accelerator. It's a $1.2 billion subsidy mechanism which exists today. The money is in our bank. And it's meant to give milestone payments to African commercial vaccine manufacturers who qualify.
By improving access to new and underused vaccines for millions of the most vulnerable children in Africa, Gavi is transforming the lives of individuals, helping to boost the economies of lower-income countries and making the world safer for everyone.
Now, of course, is the time to operationalize this strategy, now that we have secured $9 billion. Of course, the journey continues to secure the next $3 billion, and we seek your support in that journey. The first principle is country centricity. The first of those changes are to put more resources at the decision-making discretion of countries, because we respect your decision-making ability. We know that you have your own vision, you know your own problems, and we want to be able to put more money at your discretion to use as you deem fit.
For the Africa Center for Disease Control and Prevention, the Africa SADC, local manufacturing is a way to go coupled with African pool procurement mechanism.
We have countries in Africa facing stock out of medicines, total stock out of medicines. I'm talking with your colleagues, head of state from this country, with ministers. We are supporting them to get these medicines very soon, but we need to put in place strong systems that can avoid this kind of issues again in the future. This is why we are engaging our member states to consider the African pool procurement mechanism as the game changer for us, not to face again this issue.
As part of its mission to save lives and protect people's health by increasing equitable and sustainable use of vaccines, Gavi has helped vaccinate more than 1.1 billion children in 78 lower-income countries, preventing more than 18.8 million future deaths.